If you could all just take your seats, I think we're going to get started. Well, good morning, everyone, and welcome. My name is Amelia Peltz. I'm the Senior Gender Advisor in the Office of HIV/AIDS at USAID. And I want to thank you all for joining us this morning for our event, Strengthening Linkages Between Clinical and Social Community Services for Children and Adolescents Who Experience Sexual Violence. Before we get started, I just wanted to make a few announcements. There is free guest Wi-Fi. The network is Kaiser Guest, and apparently you just have to accept the terms and conditions and then you can reconnect. The bathrooms are down the hall to the left. And finally, the Center for Total Health here at Kaiser Permanente has made the exhibits in the hallways available to our group to explore after the presentation, so feel free to take a look around after our event today. So we're very pleased to launch this new technical guide, Strengthening Linkages Between Clinical and Social Community Services for Children and Adolescents Who Have Experienced Sexual Violence, which focuses, as the title suggests, on the linkages between facility-based services and social and community-based services. This guide is a companion guide to the 2012 Clinical Management of Children and Adolescents Who Have Experienced Sexual Violence, Technical Considerations for PEPFAR Programs, which provides step-by-step guidance on the appropriate clinical and forensic care for children and adolescents who have experienced sexual violence and exploitation. So global estimates reveal that 1 in 3 girls and 1 in 7 boys have experienced sexual violence. These numbers are absolutely staggering. Furthermore, studies have demonstrated the link between sexual violence and HIV acquisition. In addition to the myriad of physical, emotional, and psychosocial effects of sexual violence, there is mounting evidence that demonstrates how exposure to sexual violence as a child can lead to increased vulnerability to a broad range of mental and physical problems such as depression, unwanted pregnancy, sexually transmitted infections, and even cardiovascular disease and diabetes. Children who've experienced sexual violence need high-quality, multi-sectoral services that meet their unique needs. This companion guide, along with the clinical technical considerations, is an essential tool in helping health service providers, social workers, and community-based organizations provide these services in a comprehensive and compassionate manner. This companion guide, which our esteemed group of speakers this morning will be discussing in more detail, provides a basic framework, examples, resources, and other contact information for health providers and managers to better understand and facilitate the linkages with social and community services, to provide comprehensive care for children and adolescents, to take additional steps to help children and adolescents receive the information and support that they need, and to contribute to the changes in sociocultural norms that perpetuate a culture of violence and silence that also increases risk to HIV vulnerability. We are fortunate to have an expert panel with us this morning, each of whom will give a brief presentation. And we will follow up this set of presentations with a series of question and answers, both from myself as well as from those in the audience. So our first presentation this morning is from Michele Moloney-Kitts. She is the director of Together for Girls, providing strategic leadership, management, and oversight of day-to-day operations of the partnership. As a UNAIDS staff member, she also serves as a senior advisor to the executive director. Prior to joining Together for Girls, Michele served as an assistant global AIDS coordinator under PEPFAR. She has served as a health officer for the U.S. Agency for International Development in Morocco, Cambodia, South Africa, and in Washington, D.C. Within PEPFAR, she had oversight for field implementation and multilateral relations. In that capacity, she also served on the board of the Global Fund and chairman of the Portfolio and Implementation Subcommittee. Michele has worked as a nurse practitioner and a nurse midwife with a particular focus on underserved populations, especially adolescents. Michele, welcome.
Thank you.